Hey, Dr. Kemp.
Hey, how you doing?
Good. All right, I'm catching you just outside of Washington, D.C. today at your office at VSI, but I know you just got back from a long road trip. I actually did as well. And today we're talking about how to minimize back pain when you're traveling. Um, I'm going to call you out here to start. We're going to jump right in because I know that I know how you did this road trip and I know you had some pain. So I know. Tell me about it.
Yeah, recently just got back from a long road trip back home in Michigan to see my family, and I went up there with my girlfriend and our dog, Quinn, and it was a long 9-hour trip.
Now let's be
And
honest, because I
yeah,
also know this. Do you enjoy road travel? What does it remind you of from your childhood?
it actually reminds me of growing up making those long road trips in the Midwest with my parents, who I love dearly, obviously.
But a lot
Uh,
and siblings, right? Crammed into a car?
with my two younger siblings crammed into a car for long hours. I think once I entered adulthood, I came to appreciate the joys of air travel much more.
Okay, but you had to travel on this one because you were taking your dog,
With
and you started the trip, I know, sort of a little bit sore. Explain why, and did you do anything about it? Did you just push through? What did you do?
well, the one thing about my occupation is that, ironically, spine surgery for our patients is very effective, but it can also cause back and neck pain for the actual surgeon. And after a long day in the OR the day before, taking a 9-hour trip in the car is not something I would recommend.
Because your head was down during surgery for hours at a time, so your neck and shoulders and back are already a little sore, and then you hop into a car where you have to, like,
Hop,
lock yourself in, right?
uh, uh,
And
you're locking yourself in. It's also harder to check your blind spots because every time you turn my neck, I could definitely feel it. And we made it through. We got home safely and successfully, and it was great being home.
but you were in a little bit of pain.
I was in a little bit of pain, but we took care of that. And obviously, I think some of the things that we did on that trip, I think, are really applicable to what anybody can do on a long car road trip.
All right, so
Uh,
that's what we're going to talk about today. I know I just finished a trip with my family, and you and I had talked about this before I left. So I knew some of the tips, like stop every 2 hours, get out and stretch. But we were on 95, and traffic was not terrible, so we were not stopping. Like, we were going to keep, and I, in my head, I thought, I know this is not what they recommend, but we got to take advantage of the traffic right now. So look, we understand that sometimes you can make the best decisions and sometimes you just sort of have to go with the flow. What were a couple things that I didn't do great there. What did you do on that trip to make it a little easier?
well, I will say that
Nine hours, right?
one thing we were concerned about was that we've been taking a lot of trips, stopping breaks for our dog. Eh, Actually, we're taking a lot of stopping breaks for me, just driving in this car for a long period of time. One thing we try to do was every few hours to take a break, get outside and walk, not just for the sake of Quinn, but also for my own sake and for my back and for my neck.
Would you have been as likely to do it just for you?
No, and maybe that's a problem,
Yeah.
and and that's the reality. Um, I think obviously, taking care of Quinn and also my girlfriend, getting out of that car, getting some good exercise, some good stretches in, no pun intended, really go miles.
Yeah. All right. So
Okay,
our tip number one is bring a dog with you if you can, because then you're
sure.
going to have to stop even if you don't want to.
Dogs definitely make everything better in life. I will
They
say
do.
that.
Absolutely. So, what do you hear from your patients? How often does back pain come up in connection with traveling? Do patients ask for advice a lot on that?
Back pain comes up all the time. Back pain can actually prevent somebody from able to do their job, from be able to travel for work. Additionally, traveling can also induce back pain for sitting for long periods of time.
I know you've said you have like road warriors who talk about, when the back pain gets in the way of doing their work, but you also have people who want to travel and aren't because they're worried they're not going to be able to do it.
Yeah, we have a lot of patients that come in and say, I want to take this trip of a lifetime to Europe, or to see family across the country, and they're unable to do it because of debilitating, neck or back pain. It's a really big issue. It really is.
All right, and we don't want that happening. We want people to be able to travel however they need to and want to. I will say we've looked at some data on this, and you're right. A lot of people are hurting. The data shows that more than a third of Americans say pain has stopped them from traveling, just like you said. Especially anything that's like 5 hours or over, that seems to be a problem when people say they really start to feel it. So we're going to walk through it today, offering some tips. But first, help us understand why we're feeling it in terms of what it's doing to our body. I know, certainly there's mental stress, tight muscles, we're carrying heavy luggage or work bags, there's ergonomic issues, there's a lot of sitting. Let's go through like what's happening in our back. For example, with the sitting, why does prolonged sitting hurt our back?
Well, I will say that for one thing, as human beings, we are meant to be mobile creatures. We're not meant to be sitting for long periods of time. When you do sit for a long period of time for consecutive hours, you're putting increased stress on your discs in your back. That hurts, particularly, as you put more and more mileage on, literally on a car trip.
Mhm.
Okay.
With prolonged sitting, you also have reduced blood flow, but I don't. Why does that cause pain?
That causes pain because your muscles aren't getting sufficient levels of oxygen. We counter that by walking.
But if you're sitting for 5 hours or more,
Yeah.
then we can't.
Yeah.
Okay. And then on top of that, right, you're pulling luggage, you're moving in ways that maybe your back and your arms and your legs don't normally move. And then you can add into it what's happening in a car or a plane when it comes to like car vibrations or airplane turbulence. How does that exacerbate pain?
In the car, when you're driving for long periods of time, the repetitive motion of the bumps in the road and just the engine of the car, that can cause just fatiguing of the muscles and joints, and you're feeling it over long periods of time.
Do you
Once you
I
get,
mean, did you experience that in that
oh yeah,
trip?
absolutely.
Hitting bumps and like,
I think it's all of these factors combined, particularly with the time span of that trip. It all adds up to just pain. Not to mention the fact that I was in the OR, only 12 hours before that for a long period of time in itself. So I think the crux of the conversation really is that as humans, we are not meant to be looking down at one object for a long period of time, or be in a car for a long period of time without a break.
all
You
right.
need to keep walking.
You got to keep doing things. Okay, well, so let's talk about what you can do. I'm going to break this up into different types of travel and let's give people some ideas. And let's start with a short weekend trip. And whether you're flying, whether you're driving, but if you are flying, what do you think about big bags versus small bags? What I check versus carry? What kind of bag it should be? What are your thoughts on that?
If conditions permit, always, in my opinion, that if you can check a bag, it's great. It's one less thing to worry about while you're in the airport. It's also one less thing your back has to worry about. That you have to lug it all over all over the hospital, all over the airport, and you're literally taking a load off your mind and a giant load off your back.
I mean, it can be
Um,
expensive, so we certainly understand that, but
100%,
so can
100%.
visiting,
If you have to bring a bag, try to make it less than 35 pounds.
okay.
Okay, and make sure that it has wheels on it, something you can like pull out, that you can pull behind you, something versus something you have to carry on your shoulder, which only puts more added stress on your low back.
When it comes to those roller bags, you were saying, we need to pay attention. It needs to be adjustable handle because you want to make sure you're not bending over.
Sure.
Do you pull one or do you push it? Do you walk it by the side? What do you think is best for the back in terms of
I
how you
think probably if we're truly being critical and truly being honest, probably the best thing is something that is on wheels, just something that is just on your side, and you're just pushing it along with you. Uh, I've done everything. I think that probably works the best, but I've also done the worst. Okay, I don't recommend that. I remember my college
What
age.
is that? Is worse pulling it?
I think the worst is something without wheels that you're carrying over your shoulder with a strap. All you're doing is putting increased stress on your low back, and right now I'm just having a PTSD from thinking about those years in college that I was doing just that.
Just pulling
But
like heavy
just
duffel.
pulling heavy duffel bag over my shoulder and lugging it across an airport to get from A to B. I think there are better ways of traveling. There are better ways of packing your things into an ergonomically oriented bag or a bag so that we can protect somebody's back.
You're older and wiser now. You were telling me that you always, if you carry a bag now, you always carry it across your your where a
I would have my bag today would be on wheels just next to me as I'm walking, and literally just a glide, nice to glide across the airport.
and if
Something
you
I'm
have
not
a smaller
something
bag, it would be one that would be one you would wear across your
correct. If it was a smaller duffel bag with fewer things, but I think the weight's important, the orientation of where that bag is next to your body, and that, once again, putting less strain on your neck or your back is imperative to avoiding these types of pains.
I've heard you say too, pay attention to which side you're carrying it on. We tend to be creatures of habit, so like we tend to always carry something on one side or the other. But if you aren't able to get a rolling bag or do those things, you got to pay it switch sides, right, and give your body a.
Right. When you have a bag on one side for a long period of time, it's tending to put more stress on the muscles in particular. Having that for a long period of time without switching sides, you're going to end up having, ironically, low back pain because your body will compensate for the orientation at which you're holding that bag. So all of these things are really, really important to avoid these pains in the first place.
All right, let's stay with the airport air travel idea
Yeah,
and let's talk about a longer trip. So we still want to check the bag. Um, Say you're on a plane and you're taking a longer flight, or these days maybe there's delays and you're just stuck sitting there longer than you expected, um, and maybe you can't walk. Are there stretches that you do when you're sitting in a plane that you think help, and how often do
yeah.
you do them?
When I'm sitting on a plane, one thing I always do is that I drink a lot of water for a number of reasons. One, to stay hydrated. Also, it forces you to have to get up to use the restroom.
And
And so
why do
by
you want to stay hydrated? I know, I mean, it does great things for your body, but it does something for your back too.
yeah, you're keeping the intervertebral joints and also the discs, hydrated. You're in a an aluminum box, so to speak, or tube for a long period of time in a sitting position that has chronic effects. You make a lifetime career of making long trips on an airplane. There are things that you should be doing to prevent the possibility of having chronic back pain.
Why do
When
our
you're
discs need to be hydrated?
They need to be hydrated to basically keep the normal disc height that we can lose with time. They also need to be hydrated so that there's adequate motion. Okay. You want to remain flexible. One thing that I'm always saying is that we are mobile creatures. We are not meant to be in a static position for a long period of time. And if you are, your body is more prone to degeneration. If you're not using the joints, you're going to lose them. That's the
Okay.
reality.
All right, let's talk about stretches that it's possible to do while sitting. Demonstrate
Yeah.
something for me right now. What can we do
Uh,
to keep those
if I'm
discs?
doing if I'm doing a sitting stretch, I'm doing one side versus the other, holding that for at least 5 or 6 seconds, and then go to the opposite side as well. I'm trying to touch my toes. I am not by any means an Olympic level gymnast, but there are little things that I can do to at least help my symptoms right now while I'm on this long airplane trip.
And even
Okay,
just like the sort of a neck stretch too, right?
do even a little neck stretch, going just testing your lateral rotation, one side versus the other, doing a little bit of extension, also doing a little bit of flexion. If you can imagine me in the operating room for 4 or 5 hours at a time, I don't have that ability a lot of times. I'm just looking down, and believe me, that has long-term effects. It
So
really
what do you
does.
want in an ideal world, if someone can do a few of those stretches, what, every half hour, every hour? What do you think?
I'd recommend it at least every 1 to 2 hours. Okay, that you're employing certain these little techniques, these little tips and tricks to help you get through that long trip.
Okay, two last questions. Travel pillows, good or bad? Those ones that go around your neck.
Yeah, I think travel pillows, I think they serve a purpose because if somebody falls asleep on a long plane, you don't want to fall asleep like this.
Mhm.
You can wake up and you can have some serious neck pain, right? So I think the travel pillow, while it's important, it can keep you in a relatively straightforward position. It, however, is still a position that's not ideal for sleeping, right? You're still not lying flat on your pillow, but it gets us from A to B, right? And the same vein, obviously, if you're on a long trip, taking little cat naps is a good idea, but also getting up and walking, doing the stretches every 1 to 2 hours is also really important too.
What about one of my friends was telling me that she always keeps a tennis ball in her bag and she'll like put, you can lean back on that and kind of like
Sure.
if
Yeah.
your back is sore, or she said sometimes she takes one of her kids' lacrosse balls. Is that a good idea? I mean, that does seem like something you could do while sitting.
But sounds like that person's actually doing their own personal massage on the airplane. Usually, usually that can be quite expensive, you know.
If you can do it, do it.
But if you can do it, that's great. But yeah,
All right, let's switch to work travel now. That's a whole different ball game, and I think right. This is something some people are doing a lot. They may not even be realizing the impacts, as you were saying. So, I know you just took a work trip out to San Diego, so that was a pretty long one.
yeah.
What do you notice when you're on a work trip in terms of pain and soreness, and what do you want to make sure other people notice?
When I'm on a long work trip, I really notice the importance of being up, getting up and walking. If I'm not doing those things, and believe me, I'm a victim of this as well. In many ways, do as I say, not as I actually do. Okay, and so on these long work trips where maybe I fall asleep, or I'm not getting up as much as I should because I'm either watching a movie or I'm trying to get some work done. It can be easy to forget that as a human being, I need to get up and be mobile. I need to walk. Okay, and you pay the price for it. You either pay the price because you wake up after a long nap in an awkward position on an airplane and you have this neck pain, or you start feeling the low back pain from being in a sitting position for a long period of time.
Well, I feel like at a work trip, your computers, you're probably on your computer, so you're
Yeah,
looking down on the computer. You may not have the more ergonomic setup that you have in a home office or an office. So right, you're using your laptop in, an airport lounge, or, in a restaurant, or in all sorts of random places, right? Which
right.
probably has you working in ways that aren't so great. Um, do you do anything special to make sure that your laptop is up high, or I don't know. Do you have tips
No,
on that one?
yeah, if you can, it'd be all like we always talk about tech neck, right?
Mhm.
If you can avoid your neck being flexed in a in a position for a long period of time, that's even greater. If you're on the airplane and you have a small table in front of you, if that's possible, it's be good to have a laptop in an elevated position so that you are, eye level with that device. Okay, even with your phone, we always tell people whether you're traveling or not, don't look at your phone for long periods of time. Okay,
Or lift, you got to lift the phone up at least.
lift the phone up. Even that's why one reason why we have standing desks in the first place, so that you're always less looking down, more looking eye level. Because we're trying to prevent people having chronic neck issues where their neck is chronically flexed.
Is there
Okay.
anything that you do, like instead of sitting at a gate, do you walk? Do you pack anything to help you do exercise or stretches when you get to where you're going? Any tips
Well,
on those?
I'm chronically late to the airport, so I'm typically checking my bag and
No
then
time
running.
to
Right,
walk.
yeah, there's no time for any of this. So I'm running to the gate to be the last person to get on that plane, and it's actually a point of pride when I make it. Okay,
All right, for
but
anyone who does happen to get there
yeah,
early,
for somebody that's more punctual than me, I would say that you get up and walk as often as you can before the flight. At least get a good 5 to 10 minute walk in before you board.
do you
Uh,
take anything with you on trips like I don't know, a foam roller or an exercise band or anything that helps you with
I
stretches or anything?
I typically do take comfortable shoes.
Mhm.
So it allows me to walk in an airport for long distances. I typically also I do take a foam pillow, something that allows me to sleep, keep my neck in the correct ergonomic position to limit the possibility of having neck pain on a long flight.
That's a great point that, yeah, when you're in hotels, the pillows might not be as great when you
Yeah,
sleep, and the bed might not be either. Okay,
100%,
let's go to your
100%.
favorite road trips. How often should you stop for breaks? What's the standard recommendation?
Standard recommendation is every 2 hours or every 100 miles. It's typically what we're recommending.
Everyone
Okay.
who's done that recently, raise your hand. I know, look, neither one of
Yeah.
us can. But it's good to have a goal. Okay. No, I mean, it makes sense. Yeah, it does. If you are able to, then do. When you stop, what should we do? You actually did stop, I think, more than I did. So when you're out, you don't have a dog to walk. Are there stretches that you do when you stop?
Same, very similar to the ones you're doing when you're sitting, but standing from a standing position, trying to touch your toes, extending backwards, doing lateral rotations as well, doing stretches. Doing femoral stretches. What that means is grabbing your foot and pulling it up to your behind your thigh. A lot of these stretches are actually stretches that I've been doing for decades, as a soccer player, way back in high school and such. So these are stretches that, even as a young kid, I'm still employing to this day just to fight the chronic back pain or prevent chronic back pain from having a car trip.
Do I have to do it for like 20 minutes or can I just do like 5 minutes
I,
and
I
then move
think
on?
doing it at least for a few minutes at a time, I think that gets you across the finish line. Okay,
Okay.
but you want to do it. I think doing shorter amounts of time more frequently is more effective and better than doing long segments of stretching in shorter frequency.
Yep. Okay, you talked about tech neck. I know they make all these phone mounts, right? So that can go up higher, either sitting on your dash or, in the air vents. Um, do you have one? What kind do you use and what do you recommend? Anything that just at least gets it up? And that probably matters whether you're driving, but also you certainly don't want to look down, but even then the passenger seat and the back seat,
For
right?
sure. I think one great thing. Well, first of all, if you're driving, obviously don't look at your phones
You don't want to
while
look
you're
at
driving.
there, right? Yeah.
But obviously, one great thing about being in a vehicle, particularly if it's voice activated, you can just talk to the phone, have them call somebody. I rarely am look. I'm never looking at my phone when I'm driving, but having voice activation allows me to focus on the road and also look straight ahead. Less technical from that standpoint. If I'm on an airplane and it's often is an ability to have a phone at eye level, something you can just watch, a quick movie or looking at, text messages or photos. The whole point of this is to keep your neck straight, eye level what you're looking at, and the less looking down, the better.
Yeah. Well, I do know on that one, there's lots of affordable options if you search online for different phone mounts. And I will say, if you look on TikTok or Pinterest, there are a lot of creative parents who have even figured out, if your kids are in the back seat, you can put the iPad like in a. I've seen
100%.
one where they put it in like a large size Ziploc bag and just tape it around the headrest, and then it's up. And
Yeah.
there's some very simple solutions that will accomplish that. All right, and the last question on road trips: what about seat cushions? Do they make they make all these sort of gel cushions that you can sit on to drive or be a passenger? Do you think they make much of a difference, and why?
I think I think first of all, I think no matter what you use from a seat, sometimes people just have their vehicles just have different comfort in terms of seats. So I think that depends on whether it's effectiveness for comfort in the first place. Sometimes people do use the tushy cushy, if you will, for that pain. If somebody presents with that pain, but the reality is pain presents differently in everybody. Some people will benefit from that. Other people won't. It really comes on
Right.
on a case by case basis and some trial and error. If it helps you, keep doing it. If it doesn't help you, there's probably something else that can be used and be effective.
All right, and let's wrap up our trip. We get home. If you're still in pain, how do I judge? Oh, this is just normal. It will pass. Versus maybe I need to do something about it.
Yeah, I think that's a great question. I think it's a question that a lot of my patients are always asking is like, when is it appropriate to see a doctor? And I'd say, it really comes down to the severity of symptoms, what has worked, what hasn't worked. And at the very least, it doesn't hurt to see somebody to get an opinion. And more often than not, I'd say more than 95% of the time, it's not something that's surgical.
I know you guys always say the sooner you come to see us, the simpler the
Right,
solutions. And
right.
so we do know that, if you want to give it a couple of days to see if it goes away, but
It
in
can't,
general, the longer they wait, the worse things get.
the longer you wait, the worse it can get. It cannot hurt to see a medical provider, somebody that can give you some advice, whether it's with physical therapy, with consideration for whether we have to get imaging, that type of thing. And also, even when I'm recommending my patients, more often than not, I'm recommending myself some simple exercises that have helped me as a patient get somebody across the finish line to treat their chronic back pain.
All right, so let's wrap it up. What's your next travel plan? You mentioned it might be something that's kind of a long way away. So, if as we're all trying to make ourselves better, tell me what your next trip is you're planning, and what's one thing that you'd be focused on to try and prevent pain when you do it.
My buddy and I right now are trying to plan a trip to Japan, and
It's a long one.
that's a long way, but I'm pumped. I'm really excited. I'm hoping to do it within the next year. We also want to do some hiking at Mount Fuji when we go, and so it's gonna be a long trip there, but it's also gonna be a long, physically strenuous trip while we're actually in Japan. And so how do I take care of myself? Well, when I'm on that plane ride, I'm gonna be getting up often. Often, from what I've heard, it's a long, like at least a 12-hour plane ride, if not more. On that trip, I'm gonna be taking care of my neck, taking care of my low back, getting up and walking off and stretching off and drinking lots of water. And then when I'm there, it's gonna be maybe even worse from a standpoint of hiking. Okay. But it's something I think that we're really excited about. I'm extremely pumped. It's actually something that I'm gonna be training for while I'm still in the States. And so once again, do as I say, not as I do.
That's exactly right. Well, it sounds super fun. Thank you, Dr. Kemp. I appreciate you walking us through all this.
Thank you. Good to see you.